Hello, welcome back to another episode of Back to School Basics. I am Dr. Brittany Panico, rheumatologist at Summit Rheumatology in Gilbert, Arizona. Today I want to talk about lupus. If you are a young female, or young male for that matter, in college or grad school, and you're noticing subtle changes or even abrupt changes in certain symptoms that we'll talk about that may raise suspicion for a diagnosis or evaluation for lupus. Rheumatologists are lupus specialists who focus on the treatment and diagnosis of systemic lupus erythematosus and also cutaneous lupus, which is primarily the skin condition of lupus without specifically systemic or whole body symptoms. So both of these conditions are treated by a rheumatologist. Some patients who also have kidney inflammation or lupus nephritis are also treated by a renal doctor or nephrologist. So you may have a whole team of people who help you if you have a diagnosis of lupus. For patients with cutaneous lupus, you might also be following with a dermatologist. So again, it depends on what type of condition you're diagnosed with. So lupus is a very complex connective tissue disease that's diagnosed through symptoms and blood work. And that way, we help come up with the best formula of medication to help treat the symptoms that you're experiencing. So main symptoms of lupus can be very broad. They can be very dramatic or very subtle. But most often, we find that patients have some form of skin rash. And that rash is called a malar rash or butterfly rash, and that's primarily along the front part of the cheek area that goes across the nose, the bridge of the nose. And that's something that can present at any course of the disease, early on or even later during a flare. Sun is a very, very big risk factor for developing skin lupus or a malar rash. So if you notice after a sunburn, possibly a vacation, that you've developed this new skin rash on the front part of your face, that's something to be evaluated for as soon as possible. Other common symptoms of lupus are increased fatigue, and not just fatigue of, oh, I've been staying up late, I'm studying for finals, or I've been working a lot, or I'm doing extra things and I'm tired. This is something where you feel completely wiped out and doing day-to-day activities become very challenging because you just don't have the energy to get yourself going. So abnormal fatigue that persists longer than what's expected when you get enough rest. Some patients will experience low-grade fevers. Sometimes the fevers can get even as high as 102, but low-grade fevers. If you're experiencing weight loss that's unexplained, if you're noticing muscle aches or cramping not associated with dehydration and getting enough to eat, if you're noticing joint changes, stiffness in your fingers, or possibly swelling in the small knuckles of your hands, if you notice that your ankles seem swollen and your socks or pants are leaving ridges along your ankles, that might be a sign that you actually have lupus nephritis. So that's a component of the physical exam that you would want to get checked out right away. Other subtle things can be found in blood work. We look for changes in your white blood cell count, your red blood cell count, meaning anemia. We look for low platelet counts. We also look for changes in your liver or kidney function. As I mentioned, lupus nephritis is when lupus, or the autoimmune condition that causes lupus, starts attacking your kidneys. And that is very serious and requires urgent medication and treatment. So if you're noticing again that ankle swelling that seems like it's out of proportion for anything that you've had before, it definitely should be checked out by a physician or healthcare provider. Other things that patients with lupus can notice are chest pain when you take a deep breath or when you're lying flat. Sometimes that gets better when you're sitting up or leaning forward, but if chest pain when you take a deep breath hurts deep inside, that may be a symptom of what we call pericarditis or pleuritis, and that can involve inflammation around the heart or lungs. If you notice personality changes for an unexplained reason, or your family or friends are noticing personality changes, that can be something related to lupus as well and should raise concern and prompt evaluation. So those are some of the main features that we can see with lupus. Although lupus is a spectrum that can range anywhere from very mild symptoms to very severe symptoms that involve hospitalization. So the range of what lupus does in the body is very broad, and that's where rheumatologists can help you determine what your symptoms mean, what your blood work means, and come up with the best treatment plan that fits your needs specifically. So if you are somebody or know somebody who's struggling with a lot of the symptoms that I talk about, Summit Rheumatology is accepting new patients as early as next week, and we are more than happy to evaluate you for lupus or another autoimmune condition. If you need more information, summitrheumatology.com and info@summitrheumatology.com is our email address. Thank you, and see you next time for Back to School Basics. I hope this helps describe a few of the common symptoms of lupus.